Food was all I could think of. It took over my life. I was convinced I was fat, even though my family kept telling me I wasn't. I was hospitalized after I broke my leg. At that point, my anorexia was pretty severe, and I was in trouble. I entered a treatment program, and finally, I'm starting to get better.
I felt empty and worthless. I ate all the junk food I could, and then I felt disgusting, so I made myself vomit. This went on for years. With the help of my parents, I was finally truthful to my doctor. I started CBTE. It was hard work, but I have my life back.
These are the voices of people who got treatment and found relief from the intense and distressing symptoms of their feeding and eating disorders. There are effective treatments for the 3 primary feeding and eating disorders, including medication. Binge eating disorder, or BED, is diagnosed when people eat large amounts of food in a short time. People with BED experience guilt about their eating and feel out of control. The most effective and best studied treatments for BED are enhanced cognitive behavioral therapy, or CBTE, and interpersonal therapy, or IPT. Both help people control their binge eating, maintain a healthy body weight, work on relationships, and manage their distress. Medications can also be helpful, especially if used in combination with CBTE or IPT. Vyvanse seems to help people change their behaviors. Because it is a stimulant, it can be addictive and have side effects, so it should be monitored by a physician. Other medications that can help include SSRI antidepressants and the anticonvulsant topiramate, which seems to help with binge eating and the thoughts that accompany it. People with bulimia nervosa binge eat, but they also compensate with purging, like intentional vomiting, using laxatives, or excessive exercise. The best treatment for bulimia is a combination of either CBTE or IPT, plus an SSRI antidepressant. These medications, specifically fluoxetine or Prozac, seem to change chemicals in the part of the brain that affect distorted thoughts seen in bulimia. They help people regain control over their binging and purging behaviors. People with anorexia nervosa restrict the food they eat and are significantly underweight. They often have untrue thoughts about their bodies and weight. If untreated, anorexia can cause serious medical problems and can even lead to death. Treatment for anorexia nervosa usually involves a team approach, including nutritional support and either CBTE or IPT. The team works toward helping people with anorexia gain weight safely while changing their distorted thinking about food and their bodies. Medication is not shown to effectively treat anorexia nervosa. Feeding and eating disorders affect people's relationships, sense of self, and hope for the future. They can cause significant medical problems and even lead to death. But with the proper treatment, including medical and nutritional support, CBTE or IPT, and medication for binge eating disorder and bulimia, they don't have to last forever. People can recover and find hope and health again, just the way they are.